Alright, this is going to be a quick review for chapters 1 through 3. I'm not going to go through every slide in the PowerPoint. I am going to go through what the highlights are that you need to know for the class, okay? So starting out, let's talk about controlled substances. So a controlled substance, is something under federal law that says it needs to have proper prescriptions and then guidelines with it. So nothing supersedes federal law when it comes to medications. Alright, so with a controlled substance, what do you have to do? You have to make sure you have a proper count, you have to have a witness for wastes, and document appropriately. If there's anything wrong with that, you need to double check your MAR, double check with other nurses to make sure they didn't give a medication from your med cart. You need to verify that nothing was taken, make sure the sign-out log is correct, and if that doesn't work, you need to go to the pharmacist, the nurse supervisor, and notify everyone to write an incident report. You need to cover every base you can in regards to that missing controlled substance. With controlled substances, they are all broken down into a drug schedule. So drug schedules are between 1 and 5. Between the schedules, there's still a risk for abuse no matter what level it is, okay? So it's not only ranked on level of abuse, but also medicinal value. So Schedule 1 has a high risk for abuse and no medicinal value. Whereas Schedule 5 has a low risk for abuse, but has strong medicinal value and very low risk with it. Okay, Schedule 1 is illegal. Schedule 5 is generally going to be over the counter. So when it comes to over the counter medications, the one thing you want to be aware of is you always want to ask your patient, what are they on? Be sure you cover over the counter medications, prescriptions, and herbal remedies. Because herbal remedies can have a lot of side effects with other medications. Okay, they might not be willing, they might not think it's an issue if they're on a herbal remedy, so you need to make sure you cover that specifically in your health assessment. So, medication order. What do you need in the order? Well, 1, you need that patient's name, the date, when it was prescribed, primarily, name of the medication, the dose, frequency, and the route, and duration. Okay? So if you don't have one of those things, and physician signature, if you're missing one of those things, what can you do? One, you can't give the medication based on that. You need to follow up with the provider, clarify what they wanted, and make sure it makes sense. Okay? What are some other times you're going to hold the medication? 1, order is incomplete. 2, could have allergies. You want to assess the allergies, maybe hold medication for cross sensitivity. You also want to know for any drug or alcohol interactions. Illicit drug use, alcohol can have complications as well. It's going to directly impact what medications you can give your patient. And for any med you're giving, you want to know why you're giving it. Because if you know why you're giving it, you know what you need to assess for. So if you see some sort of abnormal finding, that's going to be, okay, I'm not going to give this, I'm going to follow up with the doctor and see what they want me to do. So what are some things that lead to medication errors? So medication error can be human error. We screwed up for some reason. Low staffing, you get interrupted a lot. Fast-paced environment, but another one of the common things that can lead to medication error is requiring multiple tablets for the same prescription. So if you have a 3,000 milligram prescription, but you only have a 1,000 milligram tablet, you require 3 tablets. That seems like, does this make sense? I should double check, make sure I'm giving the appropriate amount, and this makes sense for the patient's needs. Alright. let's go through the pharmacokinetics. So pharmacokinetics starts with absorption. So before we get into this, what are some things that are going to affect the patient themselves? So what's going to affect their pharmacokinetics? What is pharmacokinetics? It's the medication, passage through the body. All right. So what are some things going to affect it? Well, what's going to affect it is how well your GI motility works. Absorption, rate of how we administer the drugs. Not the rate, I mean how we administer it. So what route did we choose? Oral is going to be slower. Topical is the slowest. Sub-Q, IM, and then IV. Of those three, Sub-Q is the slowest, IM is the second fastest, IV is the fastest. So why is Sub-Q the slowest? Well, it has the least amount of vasculature, least amount of blood flow going through that tissue. IM is intramuscular, has a large amount of blood flow to the tissue, so it'll be a quicker absorption. IV, directly into the bloodstream. It's going to be a quick absorption. Okay? Other things that can lead to affect absorption is drug-to-drug interactions, drug-to-food interactions. If something's protein-bound, like I said, GI motility. Distribution is largely going to be affected by amount of blood flow through the tissue.